By the end of the year 2024, the 194 member countries of World Health Organization are supposed to sign a pandemic accord treaty. This is a new treaty that will allow the countries allegedly to work together, respond, prevent, and control pandemics. It was proposed in 2021 after the last pandemic. But then medical experts are raising many questions about this treaty because according to them, it borders. There are so many risks and dangers in it. And what is really packaged as a treaty to help the countries to have a united front on the fight about pandemics is actually laced with many traps in it. And what has really shocked me here is Dr. Wahome Ngare, a doctor who is based in Kenya, tried to get audience in our parliament and locally here, and did not get audience. So while attending an interparliamentary session, African Interparliamentary Conference on Family Values and Sovereignty in Uganda, he told President Museveni what Africa needs to do and really opened the eye of the continent about this move. The negotiations for the 200 countries, the 194 countries on this have stalled, and they've not agreed on a number of issues related to this. World Health Organization's Director General Tedros Adhanom called a torrent fake news and lies conspiracy theories around this statement. But I would want you to hear what the Dr. Wahome is saying. And what then puzzles many is why this information is not in public. But I want you to hear what Dr. is saying.
There is an international health regulation of WHO that is what WHO uses to guide in the management of pandemics. And there is a proposal to amend that document, Your Excellency. And the amendments so proposed are going to convert WHO, which is an advisory body that is run by bureaucrats who are not elected, into an administrative authority that will have power to usurp the sovereignty of member states in case the Director General simply says that there is a pandemic. Now, the negotiations for that international health regulations plus a new pandemic treaty are currently going on, and there will be a meeting this month, actually we are in, and the negotiations have been headed by the Ministry of Health technocrats, Ministers of Health, Ministers of Foreign Affairs, and ambassadors, and I'm not sure that they are briefing the executive and the parliaments in the different countries. Yet they are negotiating things that can destroy the sovereignty of Africa.
Instrument of colonization. I'm going to focus specifically on the red text. In the history of this formation of this supranational, the UN sought to improve colonial conditions rather than question their legality. The countries in Africa were amongst the poorest on the globe, and they were seen to be in dramatic need of help, incapable of rising out of poverty themselves, and thus dependent on Europe and the United States for development. There was thus a civilizing mission in post-World War II Africa, which postponed our claims to independence by offering us expanded services and political concessions instead of decolonization. So the WHO is an instrument of colonization. Please watch this film. There is the website. It's Infertility, a Diabolical Agenda, where you will see what happened in Kenya. The website, infertilitymovie.org. It's a 30-minute film. It's a must-watch. Conflicts of interest have infected the World Health Organization, led primarily by this man. You know him, right? What's his name? Bill Gates. He's everywhere. Apart from the internet and the IT, he's in our food. He's in vaccines, he's in agriculture, he's in governance, influencing and bribing of governments essentially. So when we talk about conflicts of interest, you will see the number one private funder there of the WHO is the Bill and Melinda Gates Foundation. That funding buys influence. It means the WHO has become an advertising company for the pharmaceutical defense industry. Does that make sense? That's exactly what it is. You'll see Wellcome Trust, World Bank, UNDP, Gates Ventures, Rockefeller Foundation, Open Society Foundation, and others. So it is not the World Health Organization, it is the World Vaccine Organization. By 2030, they aim to introduce 500 new vaccines in low and middle income countries. Again, they are targeting us.
We cannot afford to trust WHO anymore, Your Excellency. And I'll just mention a few things that have caused great concern to us. In 2014-2015, WHO brought tetanus eradication campaign in our country. It was a campaign to eradicate neonatal tetanus, babies who are born who eventually get tetanus. And the vaccine that was used is a different type of a tetanus vaccine that is a fertility regulating vaccine, where they take tetanus and combine it with a hormone called human chorionic gonadotropin that supports pregnancy. And when you inject a woman with that vaccine, she produces antibodies against that hormone and therefore is rendered sterile. So we are noticing an increase in the number of infertility cases among young couples who you examine and they are normal but cannot get children, or couples who are losing 3, 4, 5 pregnancies before they can carry any pregnancy to term. We were able to expose this, and we have even published a paper that is available. And fortunately, in 2017, WHO said Kenya is now free of neonatal tetanus, and they left our country. But they developed this vaccine over a 20-year period of research from 1972 to 1992. And they used that vaccine in South America, and it is possible it has been used in many other African countries. The second reason we cannot trust WHO, Your Excellency, is malaria. UK was able to eradicate malaria in 1921. The US was able to eradicate malaria in 1951. And from 1955, WHO has been working on how Africa can eradicate malaria, and up to today, we still haven't been able to eradicate malaria. And now they have proposed GMO mosquitoes. Seems like it's not enough to own seed that is going to be used to make our people poor because of GMO seed. Now they are making GMO, they are proposing GMO mosquitoes that apparently will sterilize the natural ones. Now, we do not know the extent of damage that that kind of activity would take. But worst of all is that they are proposing vaccination of our children against malaria. Yet malaria is a treatable disease. In fact, the herb that is being used, the trees that are being used to create quinine, which is one of the best medicines, especially where there is resistance, the trees are grown here in Congo. Artemisia afra, Artemisia annua, is a herb that treats malaria just from drinking the tea of the herb. These things are available to us, and with concerted effort, Africa can eradicate malaria without the help of WHO. Now, one of our doctors in Congo wrote a paper that demonstrated how well the Artemisia tea worked and compared it to conventional medicine, and even demonstrated it works better than conventional medicine. And 2 years later, his paper was pulled out. It was retracted. We do not need a vaccine for our children to treat for malaria. Then, Your Excellency, WHO also proposes the use of the HPV vaccine to prevent cancer of the cervix amongst our children. We are supposed to inject our girls from the age of 10 with a vaccine called human papilloma HPV vaccine. Now, that vaccine is being said to be a vaccine for preventing cancer of the cervix. Your Excellency, that vaccine is for a sexually transmitted disease called human papilloma virus disease. It is not for cancer. Now, any virgin, whether male or female, is not at risk of getting HPV. And it is only on the first sexual experience that there is a risk that one could get this disease. And if a woman got this disease and got sick with HPV, over 90% of them, their natural immunity destroy the virus and she doesn't need any treatment from anyone. A small group of 1 to 10% will develop persistent disease. And this persistent disease, undetected for 15 to 20 years, is the only time it would give them a risk of cancer. And Europe and America were able to reduce deaths from cancer of the cervix to negligible levels by only popularizing a test called the pap smear test among any woman who has ever experienced sexual intercourse, one test done every 3 years.
Your Excellency, WHO has always been an advisory organization. What Dr. Wahome is saying, the new international health regulations that they are pushing will make the decisions by WHO binding to all nations, and that is what we must resist. So if they decided that Uganda needs to have this vaccine, then it will ensure that the vaccine is actually given to all the people, because that is their decision. And those are the health regulations that we are saying should not be passed by the health ministers.
Now, Dr. Wahome
maintenant,
has now rang the alarm bell.
Vient de sonner la cloche.
I have been proudly promoting 13 vaccines.
Je promouvais avec fierté 13 vaccins.
In Uganda, you go and be vaccinated, 13 of them.
En Ouganda, disait vaccinez-vous, 13 vaccins.
Including the one he's talking about, the one of anti-cervix cancer.
Y compris le vaccin qu'il a évoqué contre le papillomavirus.
So I thank you so much. I want to read that paper.
Je vous remercie, j'aimerais lire votre document.
So you are now coming up to fight your wars, because for us we fought ours. We are now in the background supporting you. Now you take the lead and fight these wars.
Vous commencez à mener vos combats. Nous avons amené les nôtres et nous vous soutenons aujourd'hui.
And I thank you for immunizing me against WHO.
Et je vous remercie de m'avoir vacciné contre l'OMS.
Because now you have given me a vaccine.
Vous venez de me vacciner contre l'OMS.
To be careful about WHO.
De faire attention quand je traite avec l'OMS.
War, famine, and disease are strategies of reducing population. And I have put GMO there next to famine, because if you allow somebody to own seed, then they can create hunger by denying you the seed. The biggest problem with GMO is that the seed is patented, it is owned by someone. And once you use it long enough and your natural seed has disappeared, they can withdraw their seed and kill you through hunger.
Daktari Wahome is one of the most decorated doctors in the country. And what he's pointing out here is, you remember when he was making this statement, he was saying either the cabinet members and the foreign affairs, they know this thing, they know this discussion, it is going on, but they're not telling the country, executives, or they're just not telling the population. If you ask me, I think they're telling the executive. And if in Kenya, the executive know very well. The only people that do not understand or that are kept in the dark are actually the population. I wish our government would then come out clearly and clarify some of this, because otherwise there is a lot of logic and reason to worry on what Dr. Wahome is talking about. And why this cannot be taken lightly is because UK Health Minister Andrew Stephenson told the House of Commons that the current text of that treaty was not acceptable to the UK government, stressing that protecting our sovereignty is a British red line. In New Zealand, too, the negotiators have been told to prioritize sovereignty. So one of the biggest dangers in it, is what Daktari has actually mentioned, is that there is a history of population reduction efforts in Africa, despite of the continent, rather with understanding that the continent is overpopulated. The problem is greedy corporates, owners who are interested in appropriating our natural resources. The doctor maintains that ongoing efforts to reduce the population on the continent through war, famine, disease, and even genetically modified organisms, GMOs, explains this. World Health Organization, according to him, is no longer a body promoting health promoting body. It has become an imperialism arm of the global corporate interest. He said, adding that the proposed pandemic treaty aimed to give WHO the legal mandate to facilitate creation of new pandemic using new man-made viruses and the use of vaccination as a countermeasure, both designated to reduce world population through reducing fertility. I believe very well that the information needs to come out, because on matters of health, the public needs to understand. Even if you're not talking about it, the Kenyan government is silent about it. But don't you see UK government? They've gone to parliament, they discussed it, and they're saying, this one we are not going to allow, it's a red line. And if UK is opposing it, as New Zealand has opposed it, I was even seeing another story, some activists are actually going to host protest today, actually holding protest today, the 1st of June, protesting against that World Health Organization Accord Treaty. So it's getting rejection. There's so many objections that are raised on it. I like the fact that Uganda are talking about it. And when Dr. Wahome was actually talking in that interparliamentary conference, he was called to State House in Entebbe. I don't know whether their State House is in Entebbe. And Museveni wanted to hear about it and promised to read that document and will follow. Now, I think you can appreciate the fact that he gave that doctor the audience because there was a reason to listen to this. But in this country, it is a big tragedy that we don't have that audience. He also advised African countries collectively to treat all vaccination programs as a national security risk, stating, if you cannot determine what is in the vaccine that is being given to your people, you may be opening a door to destroy the African population. The side effects of drugs in this country have been a big problem. And of course, even the vaccination is a big space. And I think what I'm learning and what I'm capturing here is you cannot just write off what is saying on that line. There is something specific talking about, there is an enterprise of the new world order of the corporate enterprises that are coming up with policies, and they want to impose things so that they can take care, or rather they can get the African market. And allow me to compare this with what's happening in the country Kenya. When the president went to US, he announced in the US that under climate protection programs, they're going to waive taxes on electric cars imported in the country. Then you'll come to ask yourself a question. So if electric cars cannot be manufactured here, they're going to be imported. So already we are just creating that environment. We are just waiving those taxes, not for the country to really buy those electric cars because there is no guarantee they are going to buy, but because we want to create a market for the global corporates. So the issue of the global corporates taking over Africa is a big thing. And even in Kenya, that is a problem. And that is what then the health ministry is actually hiding from the public. It is good that probably the truth is out from Uganda. So the trend of, there are things that, there have been a complaint that we are running things. I remember the discussion about GMO, I think he's pointed about it there. That if you allow GMO, it will allow the Bill Gates and the big corporates to thrive, because we'll be buying this seed from them. But they hold the remote to our food security, because if they withdraw our seed after that GMO has destroyed our soil, we'll be in famine. And I think this means we need to take a very good question even on the issue of fertilizers. So when there were problems of our fertilizers here, there was a big discussion about that. And it's really something that has to be looked into. Are the multinationals really corporates taking over Africa? So why is it, one thing that I think Kenyans must then ask is, why is it hidden from us? Why is it the Kenyan population do not understand this? We don't have this information. So until Daktari had to go to Uganda to explain this to the locals there, and now they seem to understand. Number two, and what I'm seeing here, I want to interpret this. The depopularization agenda mooted in the West could be targeting Africa. Africa has been seen as a market because of the vast population. But that population to some people is seen as a threat. So that depopularization agenda mooted can also not be. And if, just to support this, there was an article by IMF. IMF is encouraging Africa to fund, to intensify messaging and fund family planning as one of the ways of managing the economies. I think there was that story, I should get it. IMF, they are pushing for family planning in Africa so that it helps in controlling their populations, and through that they will manage the economy. Kenya is setting up a vaccine manufacturing factory, and that is why this information is very key. I think it's being hidden from the public, because even as we are opening our gates for manufacturing a key, setting up of manufacturing factory in Kenya, the farm is coming up, and probably if this will be, if they raise these voices, they don't want to talk about it, because for them they are looking into what is in it for us. And the challenge with the Kenya is, instead of looking at the welfare of the people, the humanity, the risk, the health risks involved in it, they're looking at how can we manufacture crisis so that we make money. I can tell you, if someone is just to bring a virus here, and I'm going to bring that virus, then we do a very heavy media campaign on it, and after that media campaign, we'll come back and give you a vaccine. Kenyans will take it. Yes, the population here, they will take it. The population in the country will take it. And now, Kenya leads on, before we agree on something, is you must just look at what is in it for me. And the culture of what is in it for me, according to my observation, that is why we cannot speak about this well. And this is the truth being hidden from the public. But we should have it. I agree with analysts who say that Africa must focus on good education built on STEM: science, technology, engineering, and mathematics. That's the future of Africa, because that's the mother of inventions. It's that branch. That is where we'll get innovations and inventions. So ladies and gentlemen, that is my take. I would really want to go to the comment section and read your feedback on this. I'm still receiving your reviews on this channel, and I'm so grateful for the feedback on this. Thank you.